In my role as beauty director, I've become very knowledgeable about a lot of products, and so people are asking me about them all the time. My friends ask me at lunch, my coworkers corner me in the ladies' room, mommies ask me on play dates, and one of the things they ask me most often about is Botox Cosmetic. I get asked all kinds of questions about Botox Cosmetic.
Is it gonna look fake? Does it hurt?
Am I ready for Botox Cosmetic?
The best person to answer your questions about Botox Cosmetic is a doctor. So here we are at my doctor's office, Dr. Doris Day, and we're going to get your questions answered. Oh, Dr. Day, it is so good to see you. Can you believe that it has been 12 years since I came to see you for my first Botox Cosmetic treatment to treat those bad lines between my brows?
Where's the time gone?
I can't even imagine. I've been doing Botox Cosmetic treatments all along, but now, of course, the lines are back, they come back. But I also wanted to talk to you about treating my crow's feet. They've been getting a lot more noticeable lately.
Botox Cosmetic is the only FDA-approved treatment for the lateral canthal lines that are moderate to severe, and we know those as crow's feet lines, and they can become deeper over time. You're a perfect candidate for the treatment.
So in addition to my treatment, I have so many questions from my readers about Botox Cosmetic that I want to ask you because you're the expert.
After Botox Cosmetic, is it still possible for me to make expressions?
That's a great question, and the short answer is yes. In my experience, Botox Cosmetic is very precise and predictable, and when administered properly, it really does soften the lines between your eyes, allowing you to be expressive, but still look like yourself.
How do I find a good injector?
Botox Cosmetic is a technique-sensitive treatment, and it's so important to find a trained aesthetic physician who understands facial anatomy.
I totally agree. I get asked this question a lot, and what I always tell people is the more experienced the injector, the better.
Is it only for celebrities and socialites?
I think that's probably one of the biggest misconceptions about Botox Cosmetic. In my office, I see everybody from the secretary to the CEO on a daily basis. Any more questions from your readers before we start?
Am I ready for Botox Cosmetic?
I get that question in my practice every day. Patients coming in and asking if it's the right time for them to have a Botox Cosmetic treatment. And the way that I tell my patients is that you'll know when you're ready. You'll notice the lines getting deeper and it starts to bother you more.
Honestly, is it worth it?
I think I'm gonna take this one.
Okay.
For me, absolutely. You know, it doesn't take a lot of time, it costs a lot less than I thought it would, and I only have to come to your office a few times a year to treat these frown lines.
Absolutely true, I get that. All right, so let's start. You ready?
I'm ready.
Okay. So just relax, it's a little pinch. Common side effects include localized pain, infection, inflammation, tenderness, swelling, redness, bleeding, and bruising. All right, we're all done. You did great. In my experience, you may start to see results in a few days, and you'll have optimal results in about 30 days.
Botox